Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 24, 2025. This video is on a Lancet article on a pre-specified analysis of the SELECT trial, which is semaglutide and cardiovascular outcomes by baseline and changes in adiposity measurements. The SELECT trial assessed semaglutide in 17,604 patients above the age of 45 years, BMI greater than 27 kilo per square meter, cardiovascular disease without diabetes across 804 sites in 41 countries. Previous GLP-1 RA trials were confounded by diabetes. This analysis focuses on adiposity measurements, weight and waist circumference, and major adverse cardiovascular events. Methods: they randomized 1:1 to semaglutide 2.4 milligrams weekly or placebo. Follow-up mean 39.8 months. Landmark analysis assessed MACE post 20 weeks versus adiposity changes. Time-varying Cox models evaluated mediation. Baseline measures included weight, BMI, waist circumference, waist to height ratio. Statistics: hazard ratios per 5 kilo or 5 centimeter change. Linear and non-linear trends were explored. What did they find? Semaglutide reduced major cardiovascular events by 20% versus placebo, hazard ratio 0.80. Each 5 kilo decrease in weight or 5 centimeter decrease in waist circumference at baseline reduced major cardiovascular event risk by 4%, about 4%. In the semaglutide arm, MACE, or that major cardiovascular event reduction, was not linearly related to weight loss, but was related to waist circumference reduction. Waist circumference reduction mediated only 30% of the major adverse cardiovascular event benefit. Placebo patients with weight loss greater than 5% had paradoxically higher MACE, likely from unintentional weight loss. Limitations and takeaways: primarily white male cohort. Takeaways: cardioprotective benefits of semaglutide extend beyond adiposity changes. Suggests GLP-1 RAs are disease-modifying agents, not just weight loss drugs. Clinical pearls: semaglutide benefits patients across all adiposity levels. Waist circumference, not weight, better predicts MACE reduction. Visceral fat more relevant than total fat in cardiovascular risk. Weight loss not always protective. Context matters. Early benefits suggest mechanisms beyond weight loss: inflammation, endothelial function, and neural signaling. Eponyms and concepts: GLP-1 RA are glucagon-like peptide 1 receptor agonists. MACE, major adverse cardiovascular events, that includes cardiovascular death, non-fatal MI, non-fatal stroke. SELECT trial is the semaglutide effects on cardiovascular outcomes in patients with overweight or obesity. Landmark analysis: this stratifies outcomes post a fixed time, example week 20, to study mediators. The visceral adiposity hypothesis were central fat and cytokine-driven cardiovascular risk. In this paper in Atherosclerosis, Thrombosis, Vascular Biology, ATB, in 1998, which I was second author, we described abdominal obesity and early metabolic abnormalities in families with premature myocardial infarction. In my opinion, this study in individuals from the Indian subcontinent would particularly benefit from semaglutide therapy, since abdominal obesity is such a predominant manifestation in these patients. What is landmark analysis? Landmark analysis is a statistical method used in time to events or survival analysis to reduce immortal time bias and evaluate the effect of time-dependent covariate on outcomes. It involves selecting a predefined time point, the landmark, such as 30 days, 6 months, or 1 year after baseline, and including only patients who have survived and remained event-free up to that point. The analysis then assesses outcomes from that landmark forward, comparing groups based on covariate status at the landmark. Example, in a heart failure study, you might evaluate whether patients on beta blockers at 6 months have better survival than those not on them, but only include patients who are alive and event-free at the 6-month mark. Key benefits: controls for time-varying treatment assignment, mitigates survivor bias, allows dynamic modeling of treatment effects over different time horizons. For methodological reviews, see Anderson et al. In Cancer Treatment Reports, 1983, or Van Hoolingen and Putter in CRC Press in 2011. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.